The nursing home, in my view, can be a rather unthanked service provider. There's just so much to accomplish and so many people to try and please or satisfy. Now, we cannot replace the necessity of the home services or the powerfully important work of its administrative, nursing, and social work staff, but we can complement it. We can also be a major source of assistance for the family of a patient who must make long-term care decisions. Now, surely some discharges can frustrate a nursing home's discharge planning staff. A patient may be indecisive about long-term plans. A family may be uncooperative or not willing to assist in the overall discharge process, and no guardian has been appointed to help make those decisions. Enter how we can help. If the patient needs to be transferred to a long-term bed in another skilled facility, and the current facility is not Medicaid participatory, we help with the Medicaid application process, even engaging the family or patient via phone or other communication apparatus to get the job done. And of course, the patient doesn't pay for that. We identify areas where the patient would prefer to live in, and we reach out to as many other facilities as necessary within those geographics. If we need to call, fax, or email 50 or 100 other facilities, we will do that and effect the discharge as a major complement to your nursing home's social work and discharge planning staff's duties. We bring the two homes together, the discharging one and the admitting one, and ensure the discharge process is handled in an efficient way. Likely the home staff would not have the time to devote to such a massive communication effort, but we do. It is why we exist. Maybe a nursing home is not the option at discharge, as the patient and their representatives are simply against it, and more community-oriented care environments are the preference. We might even have a situation where programs such as Medicaid waivers are not a good fit for this person because their assets are too high. In this event, we go into our network of assisted living providers, both large and small, and work to plan an admission accordingly. Most know the meaningful advantages of community-based care, including a heightened level of dignity in the daily care regimen, and we support that. But it doesn't stop at admission. While in assisted living, we can manage every aspect of care, from monitoring services provided, to arranging medication delivery, to arranging the visiting physician services, to reporting to the person's designated representative on a biweekly basis via fax, email, telephone, or U.S. mail. We really become the eyes and ears for that patient's family. And this is especially important if they live some distance away. Now, if the patient is going home and needs to arrange anywhere from 4 to 24 hours per day of care in their own residence in order for them to manage safely, then we can arrange that and supervise that from our offices as well. Our job is to help, and we think we do it pretty well. But of course, first, a nursing home has to engage us, subscribe to the power of Project Admit, and how it can add efficiency and a personal approach to the overall nursing home discharge process. It all starts with a phone call or perhaps an email, but getting us started is a pretty simple process, and we're excited about being of service.